So, Marci, tell us your story, how a physical therapist turned into a functional medicine practitioner.
Sure, yeah. So I had twins in 2010. And after they were born, I just started having some health issues. I had started with kind of like a rash developing on my abdomen while I was pregnant that just kind of kept getting worse and then developed into pretty severe back pain. And as a physical therapist, that was the primary thing I treat, and I'm pretty good at treating it. So when I wasn't helping myself, I finally went and saw my doctor. And they kind of blew me off and told me that it was I just needed to take Tylenol or Aleve or cycle through Tylenol, Aleve, Advil. If that didn't work, they could give me the pain medication and the muscle relaxer and all the things that they do for back pain in this country. And it wasn't, my body doesn't respond well to medications. My entire life, I've had trouble even taking Tylenol. And so I just kind of thought, that's not the answer. And a lot of people in my family have autoimmune disorders. And so I started looking at, well, what does rheumatoid arthritis or ankylosing spondylitis look like? How does it typically start? And decided that maybe that was what I had. And so I went back to my primary care doctor and said, again, I don't want the medications because I don't respond well to them. I just want the referral to a rheumatologist to get this checked out because I think this is what's happening with me. And I want to get on top of this early. And she still prescribed all the meds. I never went and picked them up. And then sent me to the rheumatologist. And I went to the rheumatologist's office, told them a little bit about my story. And they said, okay, well, we want to inject you with this drug and see how your body responds to it. And I said, wait, isn't there something like a test we do first? Like there's genetic testing that can be done. There's imaging that can be done. There's all these other things. And they said, this is the way we do it in our office. If you don't like it, you can get the F out. My husband was sitting in the appointment with me.
I hope you guys walked out.
We did. But it's a really sad, I realized that was a person who I trusted and referred people to, right? Because they're a rheumatologist, they're a specialist at this. People need someone to manage an autoimmune disorder for them. Like that was my belief pattern before that experience. And it was really disheartening to see that. And even, my own family physician who knows that I treat back pain because I send them patients all the time saying, I know you said you don't do well with these drugs, but just try them anyway. Like just blowing me off like it didn't matter. And so I knew that I had to find a different way around it. And I know you've interviewed James Maskell quite a few years back, but he was one of the first people that I found talking a lot about functional medicine. And he interviewed a gentleman by the name of Sachin Patel, who I have then had as a mentor for a while. And watching their conversations around how we manage symptoms instead of cure disease in this country, I really decided that there was a different path and I needed to find it, and started looking into more natural ways to help with autoimmune disorders, and literally went from 4 years of back pain that was a struggle to get up every day to no back pain in 6 weeks.
Incredible. So tell us how you did that.
So part of it was really changing my nutrition strategies. I've never been somebody who eats a lot of junk food, but as we know, when you have an autoimmune disorder, there are some foods that can create a little bit more inflammation. One of them primarily was gluten. So I eliminated all gluten from my diet. I've been gluten-free actually now for about 10 years. And that was the first step that I did. And that actually cleared up the rash that I had. That was helpful. But now, interestingly, anytime I get glutened by someone accidentally, I can see the rash come back, and it's like it follows that piece of food through my intestine, and you can see it on my abdomen follow that piece of food. It's fascinating.
Wow. You should catch it on video sometime. Like doing a lap video. Serious.
I probably
that is very interesting. I've never heard that before. I believe it. I've never heard it before.
But I get anxiety sometimes, even when I eat out at a restaurant, because I'm like, oh my gosh, is this going to be? Right. So I have anxiety about food, not because I don't like to eat, because I actually really like food, but because I'm afraid that I'm going to accidentally get a cross-contamination exposure somewhere. And then after doing the gluten, I took out for a while all of the nightshades. So I had given up things like bell peppers, which I love. I gave up eggplant. I gave up tomatoes for a while, and anything that was tomato based. And I'm Italian, so that's a problem.
Oh.
And then also gave up.
Potatoes are nightshade, correct?
Yeah.
Yeah. So did you give up potatoes?
I did.
Okay.
And I still don't eat those that frequently.
No nachi.
No, it was it was very sad. And then I also gave up things like any kind of sugar, even any artificial sweeteners. I gave up honey for a time. Anything that looked like it could create inflammation in the system. And I gave up all grains for 6 weeks, including rice, quinoa, all of that. And then as the pain started going away, kept continuing to work on things like core stabilization and segmental stabilization in the spine, and then started slowly adding stuff back in, kind of like you would with a newborn. So I would put something in my diet that I hadn't had in a while and then wait 3 or 4 days and see what the response was. And kind of the responses I was looking for were things like, do I have aches and pains? Are my hands swollen? Can I still get my wedding ring on and off easily? Did it change frequency of like urination or defecation? Did my bowel movements change? Am I more constipated or have more loose stools? Like, what does that look like? So I was really evaluating every possible symptom, including, how did I sleep? Was it easy for me to fall asleep? Did I wake up multiple times? Did I wake up before my alarm? Did I wake up with my alarm? Did I feel refreshed when I woke up? So I was really trying to evaluate every single thing and see how my body responded to that food. And for the most part, I've added back in most things. I still don't eat a whole lot of grains because my body just doesn't tolerate them well. And I'm very careful with some foods. Like I did find out that I had this weird irritation occasionally in my mouth when I would eat spinach. And when I say irritation, people are going to think this is crazy, but the whole inside of my mouth would peel about 3 days after I ate spinach. And for me, that was just like oh, whatever, it's not that big of a deal. It's probably my toothpaste, because when I was little, I was allergic to toothpaste. And then I had an anaphylactic reaction to spinach and thought,
Wow.
that's not normal.
I wonder if it's, because spinach is high in minerals because it's grown in the ground. I wonder if it has to do with minerals in the spinach.
So it's possible. There's all kinds of things that could be, right?
Yeah.
One of them, I have an anaphylactic reaction to latex, and spinach is in the latex cross-contamination of foods. And interestingly, spinach also is a gluten cross-contamination reaction for some reason. In the literature, if you look that up, you'll find like gluten and spinach, the protein is seen very similar and your body just reacts to it.
Interesting.
Yeah.
So basically you did an elimination diet and you started adding things back in.
Yeah.